Good evening, everyone. Welcome to Promoting Access to Health Information, hosted by the New England Minority Nurse Leadership Collaborative. We're so happy you've joined us this evening, and we look forward to sharing this presentation with you. A couple of housekeeping items. Following this presentation, please look for the evaluation link. It will be placed in the chat and it'll be on the last slide of the presentation. You will need to fill that out and complete it in the same manner in which you registered. Upon completion, your nursing CEU certificate will be emailed to the email address you used to register. Also, we've left time at the end of the presentation for question and answers. However, we'd like to make it as interactive as possible. So please submit your questions into the chat and we will try to answer them in real time whenever possible.
I named you Monica.
And
just, do you want to start recording? Just a reminder.
Yes, I have, I believe.
Yes, you're good. You're good.
So the New England Minority Nurse Collaborative was established in 2014 by 3 Robert Wood Johnson Executive Nurse Fellows, Lisa Davis, Deborah Washington, and Gardia Bannister. The cornerstone event of this group is the leadership conference that is held every fall. And this year we will hold our 7th annual on December 4th. The mission of this collaborative is to develop nurse leaders through networking, mentoring, and advocacy as it relates to health disparities. The collaborative consists of 10 New England chapters of the National Black Nurses Association, the National Association of Hispanic Nurses, Caribbean Nurses Association, and most recently, the National Association of Nigerian Nurses. Tonight's event is made possible by a grant award from the Network of National Libraries of Medicine. The purpose is to engage community organizations, healthcare providers, and the general public in a discussion about the significance of access to health information. 7 chapters are participating in this grant award. Representatives of 5 of these chapters are presenting tonight. Our objectives are to identify health information resources and services available from the National Library of Medicine and the Network of National Libraries of Medicine that are available and free to organizations and individuals. Our second objective is to select and highlight relevant databases and resources from the NLM and the NNLM for projects and areas of practice. Again, we thank you for joining us and we are going to get started. First, we will introduce ourselves as your speakers for this evening. My name is Andrea Morel. I'm a nurse manager in New Haven, Connecticut, and I represent the Southern Connecticut Black Nurses Association.
Andy, do you want me to chime in here? Yes. Hi, good evening, everyone, and welcome. And thanks for being here. My name is Raquel Womble-Ortiz, and I am the president of the non-Massachusetts Greater Boston chapter. And I'm very happy to be a part of the New England Minority Nursing Collaborative. And I hope that Many of you will join us in December for our next conference. Thank you.
Hello, everybody. My name is Cassandra Momren, and I'm the Vice President for the New England Regional Black Nurses Association.
Good evening, everyone. Welcome. My name is Kim Kim. I'm the chapter president of Non-Hartford. I work as a diabetes nurse educator, and we're so thrilled that you're here this evening. Thank you.
Hello, my name is Kiara Ledger. I'm a nurse manager at Boston Children's Hospital, and I am part of the New England Regional Black Nurses Association. Good to see you.
You're muted, Gloria.
Sorry, that won't work. Good evening to all of you. My name is Gloria Wilson. I'm a nurse care manager at Bay State Mason Square in Springfield. I am the membership chair at Western Mass Black Nurses in Springfield.
Hello, everybody. I am Raquel Reynolds. I am a nurse educator and a nurse researcher in the Boston area, and I'm a member of the National Association of the Hispanic Nurses in the Greater Boston area. Thanks for coming.
So the National Library of Medicine is an institute of NIH, and it's primarily tasked with finding ways to bring NIH information to people, mainly through the databases that provide biomedical information and run from highly specified searches to information for the general public. The network of the National Libraries of Medicine, or the network as it's known, is the bridge between the NLM, the National Library of Medicine, and its resources, and the communities and organizations which it's targeting. The NNLM is made up of 8 geographic regions. We are part of the New England region. In New England, our office is located in at the University of Massachusetts Medical School at Worcester, Mass. The databases and services provided by the network regional offices are free to all of us.
Thank you, Andy. So as Andy previously said, there are many resources available to healthcare professionals and the public. And as you can see, there's a web address up there at the top of the slide that I encourage everyone to visit. And there you will find a myriad of resources, listings, and they're actually targeted. They have different populations. I went there myself just to see and know of what I speak, and I was amazed at how much information there is available for seniors, for veterans and their families, for teenagers, for the public. And there are also other links that interconnect with public libraries in your communities. As is stated here in this slide, anyone who is an organization that provides health services or information should and can become a network member, and it is free to join. Next slide, please, Andy. Slide number 6, I believe. Yes. So as you see, resources for you, training and support. Andy, if you could please toggle over to the website, if you're able to. Yes, that one right there. Perfect. Thank you. So that's the one that I went to. That's the page I was speaking of. And so in the search bar, I typed in resources, and that would bring you, actually, it brings you back to the home page. But you can always toggle back and forth. Just remember that once you're done looking on the homepage, that you hit the tab that says regions, and there you will see all the regions. You hit New England, and it will bring you back to this page. So basically, you're going to be going back and forth. I can't see if it's showing up on here, Andy. Were you able to put in resources? Maybe I should exit the full screen.
If you scroll up a teeny bit, Andy, I think you'll be able to see. There you go.
Yeah. Thanks, Kim. I can't see it from my view. Yeah, perfect there. Okay, thank you. So that's the list that I was talking about, online resources. And if you could please scroll down, Andy, you'll see printables. They have PDFs. They have posters, community assessment. Yep, and every time that you click on one of those, it does bring you back to their specific page. So I was looking at the different pages. I just went from page to page, and then I saw the libraries link. So when it actually says public libraries. When I typed in that one, resource library, yeah. Me personally, I was like, this is wonderful. This is something that I can use, especially if my chapter, along with other chapters in the area, are part of a health fair or, well, post-COVID, and when it's safer to do so. You know, we can print out these PDFs and brochures and pamphlets. And there's also specific ones, like I said, for seniors, for teenagers, for veterans, for students, and they are in many languages. Information on food, health literacy, it goes on and on. So I highly recommend that you visit this site and bookmark it. Thank you so much, Andy. And now moving on to slide number 7. So this one is for certified health education specialists. And they have their own organization here. I don't know if I'm using my cursor, but that website down at the bottom, that's actually the credentialing body for certified health education specialists. Now, the NNLM will help specialists obtain the required 75 continuing education that is needed every 5 years to maintain certification. And that would be the National for Health Education Credentialing. Thank you.
Okay, so in addition to supporting grantees and teaching, NNLM has outreach and education coordinators that also handle special initiatives. And these initiatives focus on areas of interest to the people that they serve. Special initiatives for the New England and Research and Data Management include hospital library, substance use, and graphic medicine. As you can see on the slide, there are different types of examples of graphic medicine, and they involved comic strips. Graphic medicine and graphic novels and comic books, they use health and wellness disease focus or theme, and it's a unique way to reach health information and health literacy among special groups. Graphic medicine provides support for providers, which builds empathy, looks at patient as a whole person and individuals. Patients and families that are fighting stigmas, feelings of isolation. The general public can approach this complex health topics that makes it less daunting and fighting the stigma. The Graphic Medicine Initiative also includes learning opportunities, webinars, funding, and book club toolkits. The Graphic Medicine Book Club toolkits, there are programs in the box that allow you and your staff and your patients to try out graphic medicine. And in addition to that, you would receive 6 copies of a book, how to read the comic handout, and discussions, guides, and supporting health information. The kits are completely free to use and cover 11 health topics, including addiction, aging, AIDS, cancer, epilepsy, emergency preparedness, response, grief, LGBTQ, health and mental health illnesses. Next slide. In addition to the special initiatives, there's also a substance use disorder initiatives. And there are resources that are made available that can help those who would like to address these types of issues. They also address substance use on a national level. Yeah, thank you.
Okay, we're going to take a pause for a moment and pull up a quick survey question for the group. All right, so we want to gauge the audience's comfort with using some of these free resources. So if you can go ahead and answer these for us, that would be wonderful. Are we good, Andy? You want me to proceed? You're muted.
There were a couple more people who are voting.
Okay, no rush.
We're just about there.
Awesome.
And we'll show the results at the end, but it looks like there's a wide range of comfort levels with these resources.
Okay, great. So just as a reminder, if you have questions as we go along, please feel free to drop them in the chat, and the speakers will monitor that and ask questions as we're going along. So we're coming back to this slide to sort of ground ourselves in where we're going next. So we've been talking about the National Institute of Health, and Raquel was speaking to us about the New England region specifically has a website. And so now we're going to be looking at the National Library of Medicine. And the National Library of Medicine is the actual physical brick and mortar that's located in Bethesda, Maryland. The NLM contains databases of health information. So there's 2 major large databases that many people are aware of. Those are Medline Plus and PubMed. So we're going to do a live demo on how to access these databases. And a little further on, we're going to reference another called Disaster Lit. And so we have seen that that's become very useful during the pandemic. So I'm just going to read a little bit from the slide here. Medline Plus is a health information site that offers plain language for the general public. So we want to just emphasize here for those of us in the healthcare workplace that we can help folks navigate that website for information in a language that they'll be able to easily understand. It does review symptoms, causes, treatments, prevention, and more. Medline Plus includes links to other trusted resources to allow people to do further reading. It's a good resource for finding background information, including basic information for those with no healthcare background, as we mentioned, and an alternative to searching health information on sites like Google and potentially pulling inaccurate information. Okay, so we're going to toggle over now for me, Andy, to Medline Plus. And as you can see, we're going to use a hot topic at this time of COVID vaccines in our search box. And as we start to type in, we're going to see that the search engine is going to start to pull up some recommendations for us. And If you can come down a little further for me, Andy. Okay, so you can see here that the result is 1,109 links. And a little bit further up at the top, right, that center where it says COVID-19 vaccine. So this is going to give us some basic information about the topic we've searched. On the left, you see that we have additional links and resources in different formats. So NLM wanted to make sure that everyone accessing this page had multiple ways of accessing information in their preferred modality. So on the left here, you can see that we have refined by format, so we can access information through videos, images, and PDF. As Raquel was referencing, those can be very useful for us when we're attending things like health fairs or sending patients or loved ones information. Andy, can you click on the first result for me, please? Oh, one moment. Okay, so just for a pause, can you go back to the top for me, please? Thank you. So just along the top, there are additional drop downs and menu items that we can utilize. So you see health topics, drugs and supplements, genetics, medical tests, videos and tools. And I'm going to get to the language piece in a moment on the right-hand side, but that's another search modality within Medline Plus. So here at the top, you see that it's pulled in summary, and Andy, we can start to scroll down. There's going to be a variety of subheadings, including this one that's called Start Here. And so here you're going to see links, and we could pause there for just a moment. Here you're going to see that we have links to sites that NLM has determined are reliable. So many of those are going to be our public offices. We may have information from some of the organizations that oversee these disease states. So for this one, we might see links to the CDC. Just keeping along with my notes. Sorry about that. We're going to see, if you scroll down a little bit further for me, Andy, related issues. And so these are going to be additional topics that we can toggle, so to speak, from our original topic that may be relevant to us. Then we get into some specifics. And so here you see that they're breaking things down by different pharmaceutical companies and such. And can you keep scrolling for me, Andy? Again, videos and tutorials, statistics and research, clinical trial links, journal article links. And if you keep going, there should be some that say handouts. Yep, patient handouts. So here we are again with reliable information that we can share with patients or loved ones, family members, even members of our organizations if they're asking questions about health information. Can you scroll back up for me, Andy? At this time, I'm going to direct your attention to the right-hand side of the page, and right there is perfect. So you're going a little bit up, just a teeny bit. So one more box. It should be red right there, medical encyclopedia. Sorry, I'm just following along with my notes. Okay, so Medline Plus also includes a medical encyclopedia section where people can find a fuller overview of conditions or topics, including in-depth information about prevention, causes, treatments, diagnosis, and more. Additionally, we see related health topics. And so this will link us to, again, reliable information about related topics, including in the next box, links to other organizations. So for this one, National Institutes of Health which is referenced. And again, we have access to changing language, but I am gonna talk about that next. So if we can go back, can we do a back to the main page for me, Andy? Perfect. Okay, so if you see the Espanol on the right-hand side of that toolbar, so if you were to click on that link, all of Medline Plus is completely fully available in Spanish. It's the only language in which the entire website offers in a second language. And from, you can click back to English. It's going to have the same format as far as where you can find health information. But Medline Plus does offer health information in other languages. It just may not be as robust. So keep that in mind when searching for information in other languages. So as you saw when we were on the COVID-19 page on the right-hand side, you will have that box that'll show you other languages and you can click on that. Okay. Also at the bottom of the page, you can access health information in the multiple languages, and NLM provides these translations from a reputable and reliable translation company. So they wanted us to be aware that it's reliable health information and you can access them in English so that you can understand what the patient would be reading in their own language. As a reminder, all of this information, including the handouts we referenced, are free and accessible to the public. So Andy, now we're going to toggle to the second search engine, which is going to be PubMed. So in this one, there was an update in the summer of 2020. So this page may look a little different if folks haven't visited it since that time. And here you can also do a search right from that search box, just like you would any other search engine like Google or like we just saw with the Medline Plus. You do not need to use modifiers like words and, or, not, or brackets unless you feel comfortable with this way of searching. So we're going to go ahead and utilize COVID vaccine again. And we're going to, can you pause right there for me, Andy? So on the left-hand side, when you see those dates, 2006 to 2021, you can actually click and drag those circles to narrow your search. So for any students who may be joining us on the line who may have instruction to only pull research articles from the past 5 years for a paper they're writing, they can go ahead and limit their search by narrowing those dates down. If you go down a little further for me, Andy, here you can start to modify your search by selecting abstract, or if you want to only pull free full text. We would be able through PubMed to access many abstracts. So you would be able to read the abstracts, but not all will have a link for free article in full text. So if that's something you're hoping to get, you would want to go ahead and pre-check that. Also under the article type, if students have heard from their instructor that they need to pull items like systematic reviews, randomized controlled trials, or meta-analysis, those are going to be references that are considered to have less or zero bias. And so those may be additional ways that we can narrow our search. Can you click those three for me, Andy? Systematic review. That's fine. And so you see here, you can go up just a tiny bit more. A little bit more, right there. So we've narrowed our results to 93. So we're going to probably see more narrowed results as we go ahead and modify our search on the left-hand side. Andy, can you please choose the first article that comes up for me? All right, so as you scroll down, you're going to start to see abstract. You can keep going, Andy. I'm going to be referencing something at the bottom. Keywords, figures, updates, similar articles. I think students would love to access this because it's going to help them quickly find articles that are related to the topic, as well as the references, and keep going. All right, right here, this mesh terms. So mesh terms are terms that have been identified to easily provide links to additional resources. So this article has ruled in to have these mesh terms that are listed here. And by clicking on any of those, we're going to pull in more research results. So we were excited about sharing this information for those of us that are in school, as well as students who may be attending in any of the health sciences. And again, this is being recorded. So if you want to share after the event, we'll be sharing the link. It's a great resource for students and the general public to access back on the Medline Plus. But for this PubMed, it's really wonderful for students to start to learn how to modify their searches and how to access free resources. Because many of them we hear sometimes when they're not on campus, they get a little nervous about accessing sites that are reliable. Andy, we can toggle back to the presentation. I'm just going to have a few more words on my Medline Plus slide. Right here, perfect. So there's going to be over 1,000 diseases noted on Medline Plus. Again, as I mentioned, you can learn about symptoms, causes, treatments, and prevention. So all those key features that students are very eager to learn about when accessing health information. In addition, students can actually access topics under those headings of health topics, drugs and supplements and such. So when they click on health topics, there's additional search engines, like they can search for areas of the body. They can pick neuro as a topic, and then there'll be another link to topics specifically about that area of the body. These links are updated daily. They provide multiple ways to access information, and again, in many languages. At the bottom is the link that can bring you to Medline Plus. You can go to the next slide, please. And PubMed, just as a quick review, 28 million citations for biomedical literature from life science journals, online books, and more. Again, abstracts will be free, but some of the journals do require payment and may pop up with a payment wall. So we can remind students or those accessing research to click that free full text if they're only wanting to access those full texts. We can find abstracts and citations and get those links that we talked about. And a really great feature is that medical subject heading, the mesh terms that will help us link to additional articles. Thank you, Andy.
So this website, the DEMIC, is basically a disaster website for healthcare workers. If you work in emergency management or if you work in the ER, anyone need disaster training, and it's for consumers. You can access health information and technology. It helps with disaster preparedness because you want to get the information, get the training before a disaster happens. And it teaches you information, how to respond to it and recovery. So of course, we're in a pandemic. It also has a bunch of links that can provide information, whether for us, it's blizzard, there's hurricane, tornado, it depends on where you live in infectious disease. And there's also the WISER, which is a wireless information for emergency responsiveness. It really focuses on hazardous material, if there's household cleaners that sometime a kid can ingest. So there's a lot of information. And if you work in a hospital where you're part of emergency preparedness, there's like different toolkit to help you with training for disaster, whether it's a chemical spill. So there's a wealth of information that you don't have to reinvent the wheel. And it's right there for you. And there's news and daily event that they update you daily. Next slide, please. This slide, basically, it's a rich data repository that helps guide with disaster as far as research, literature review, where it's a trusted website and it has materials that you can learn, lessons learned from disaster, trainings again, and drill, code triage, different codes that we have, drills that the hospitals or schools can run to help people get ready for disaster. And these journals, articles are peer reviewed, and you find articles like the IOM report and government materials, white papers, different policies and guidelines that you may need to write in your facilities is quite helpful, and you get occasional congressional hearings. Next slide. This website is almost like what everyone was alluded to earlier about. There's lots of information. So this website really particularly for AIDS information, and it's in a language that is easily to understand. Again, it's also in English and Spanish. There's information sheet like how the side effect for medication, how my lab result, how do I interpret that? Of course, we always tell the consumers, please consult with your physician, but there's a wealth of information, whether it's AIDS research, and there's also information about community outreach, and they can, if you know someone who's living with HIV or AIDS, they can become a member so that they get information and really give them tools how to live with this disease and information that they may have, and also clinical trials of new drugs that they may not necessarily have heard about. So there's all that information, and it's really valuable. Again, it's part of the National Library of Medicine that works through the hierarchy of NIH. So this is a great website. Again, we know all these websites, they have some, information right now with COVID, AIDS, and people with COVID. So it's really useful. Ms. Gloria?
Good evening. I'm going to move forward with clinicaltrials.gov, and it is a database of privately and publicly funded clinical studies that are available around the world. And so it has numerous types of studies that are offered. Patients and families for you health providers. Patients and families have the opportunity to search for information around various diagnoses that they're have an interest in learning more about. They can participate and learn new interventions and treatments that are out there and that are being considered. Working with some pediatric parents, I learned that they were using such sites to find out more about their children's diagnosis and then knowing what to expect. So it's a great site for finding its trials, but it is a great site for patients and families. I'm going to move on to researchers. So for researchers, the clinicaltrials.gov offers them an opportunity to work with other collaborators to identify other opportunities related to different searches and the opportunity to actually find research topics that they are looking for. You can filter it as far as recruitment by age and group, sex. So the filters help you to navigate through. You're looking for a particular funder under researchers under this clinicaltrials.gov for researchers that are designated areas. So I'm going to go on to filtering by location. I'm sorry, I didn't move to the next slide yet, but it's filtering by location in relation to the trials that are being conducted in various locations in states, countries, and they're funded. The searching, let me give you an example. If you were looking for a particular study related to Yale, if that study was being conducted elsewhere in the world or in another country, it would also come up in relation to this area. Next, I'm going to go on to the National Information Center. This is an umbrella of services. And basically it's studies that are in progress and with various partners, and it offers a great deal related to the partners and just ongoing progress. I'm going to go to health services research. And that is related to also studies or projects that are in progress, like the clinicaltrials.gov, but for public health, social, and behavioral studies and interventions. It's a good place to search for ongoing research and looking to fill information and gaps in relation to partners or others that might be studying similar topics. Thank you.
And if you'll actually back up one slide, that would be great. I'm just going to quickly tell you a little bit more about this health services research projects in progress. It basically is research of all types that is ongoing and not necessarily published quite yet. And it could be used as a resource to see what's going on out there that is literally just budding in nature all across the country. It's got a feature, just like you see in the graphic, where you can search across the United States, or you can use the search bar to find out which research studies are going on. You could also add your own study. If you're a researcher, any researchers out there, you can add your own study so that it's out there in the World Wide Web to share that you are doing something and how you are doing it. On the right hand of the screen, you see another resource that is Health Services and Sciences Research Resources. That is a kind of a repository for all the different databases used in research. You can type, as it shows on the graphic there, a key term in the search bar, and it'll pull up all related materials that related to research and research resources for that topic. For example, earlier today, one of the studies that I'm currently conducting is around health literacy. So I just typed in health literacy in that search bar, and it pulled up not just resources in terms of articles and best practice around health literacy, but health literacy tools that can be utilized as well. You can use any type of topic, whether it's a disease, condition, or an illness, or any other health education topic that you're interested in. If you'll switch to the next slide, please. This slide kind of goes over everything you could possibly think of in terms of public health and all the resources available to you. So this Public Health Partners is basically a hub of all public health related resources that you can click around and become familiar with if you are maybe a novice to public health, or you don't know exactly what you're looking for. If you remember that public health can be anything from sanitation to infectious disease to environmental health to all kinds of different things that in health policy, for example. So if you want to just kind of click around and familiarize yourself with those topics and figure out how does sanitation relate to nursing, for example, or why is food safety important, you can click on some of the resources related to those topics. If you are interested in evidence-based practice or evidence-based practice guidelines, you can use something, for example, like the AHRQ that will provide some EBP guidelines or standards of practice for you. There's all kinds of things, as many of these websites, we've probably said that over and over again, they're just a huge amount of information that you can access. For those of you that are in kind of school or maybe need training resources, one of the resources that you can access through Public Health Partners is a website called Train, T-R-A-I-N. Within Train, you can access various online training modules, one of which that I've used recently is to learn how to be a contact tracer. You can take an online multi-step module and become a contact tracer. I actually use that as an assignment for my students. So you can kind of click around and find modules like that. I've also used modules within that to teach how to administer vaccinations, for example. So a wealth of information on all of these various topics. Next slide. If you have any questions, we're seeing some pop up in the chat, and there's been some interaction, but any other questions you'd like to shout out and ask to the group, we welcome them now.
I'm going to jump on and address one of the questions that I read because it pertained to my slides. So someone was asking, can they narrow their demographic if they're looking for health disparities for specific populations? And the answer is yes. So specifically within the Medline Plus in regards to health information, when you open up a topic of interest, one of the subheadings would be that you can narrow the population there. So that's a really great question. That may also help narrow down some of the information presented in the handout section. So NLM's documents are going to keep things at less than the 5th grade, I believe, literacy level. And again, plain language, but there is an option to modify your search based on population information. So those are really great questions. So there's a question, let's see. A comment that Train is a good education tool. I'll ask this out to the group. Are there any good websites to find health disparity information in a general sense?
I saw that question pop up just now. So I guess it depends. Are you just looking for like statistics or trends or like evidence? What is there something specific, or just kind of anything related to health disparities?
I'm monitoring it.
That was Keisha, I believe.
Mm-hmm. You can unmute yourself as well if you'd like to join in. Ask poverty rates and premature death rates.
Okay, so probably the best place to look for that would be through the public health partners. You can access some information that will lead you into some kind of current evidence related to Healthy People 2030. You could also go to healthypeople.gov, which is directly into Healthy People 2030, and that will pull some information related to those specific topics and health disparities. If you're looking for research papers or manuscripts related to health disparities, your best bet is probably PubMed.
There was a question about, can we find something on prostate cancer and new medication?
Thank you.
I believe I just answered that privately, but if you use the HSSR website and use the tool, the search tool there, just type in prostate cancer, you should be able to find some information for those topics, including screening guidelines and some latest research and other evidence guidelines as well.
Thank you.
Andy, can I ask you to toggle back to the New England page, please? Oh, not the slide, the website, the NER website that Raquel Wamble Ortiz started with. I just want to point out one feature. Yep, perfect. So Raquel, do you want to speak about the calendar under the About NER dropdown?
Yes, Andy, if you please, where it says, yep, this one right there, About NER, click that, please. And about, yeah, where the calendar. So, this is March, but if you go to the next month, yeah, and that will bring us to the April calendar. And if you could scroll down a little bit, thank you, perfect. So as you see, there are many different, these are webinars, chats. There is actually, one is a symposium, a 2-day symposium, and a very interesting one, and I think very relevant, is the one on April 13th. Would you mind clicking on that, please? From Being to Doing, Anti-Racism as Action at Work. So as you see, this gives you the description. And please scroll down a little bit. And registration is required. And that's all the different systems, I guess, that they use, WEX. And there's something about continuing education there. A little bit higher, please. Oh, yeah, there, continuing education. I didn't click on that one. I didn't get a chance to, but could you please click on that just to see what information is there? So it's free to everyone. And oh, so there's 1 to 1.5 CDs. I'm not sure for who, it doesn't say. Perhaps it's up in the description of who is eligible for these CEs. But yeah, I just want to highlight this upcoming webinar.
Can we go back to the slide deck to the last slide, please? So I just dropped in the chat box a link to our evaluation. We will continue to take questions, but that is the direct link to bring you to the evaluation for today's presentation so that you can get your CE credit emailed to you. In addition, I just wanted to highlight on the Medline Plus regarding the question about prostate cancer and medications. On Medline Plus, you can also use a search feature that is under medication. So you can look under disease states, you can look under medications, you can look under regions of the body. It's really wonderful for students to be able to look for health information from a variety of points of view. So it's a really great tool. Are there any additional questions? Okay, it looks like no additional questions.
Yeah.
Thank you, Andy.
Thank you, Andy. Thank you, Kim.
So we would like to thank you all again for joining us this evening. It's very important that you complete the SurveyMonkey evaluation. This is information that should get out more widely, so your feedback will help us do that. Are there any other housekeeping items?
Yes, so there's a question about will the recording be placed on the website? So we will get the recording on the website, and we can also send it along in the email with the CE certificate so everybody has access to it. Earlier in the chat, I did drop the link to our New England Minority Nurse Leadership Conference website. So that's www.NEMNLC.org. If you want to follow along on that website, you can access all of our minority nursing orgs, as well as get updates on any events that we're offering.
Yes.
And with that, we'd like to thank you for joining us this evening. We again look forward to seeing you hopefully in December for our annual conference in one form or another, either virtually or in person. Have a good night, everyone.
Night.
Good night.
Thank you.
Thank you, everyone.
Thank you so much.
Thank you. This is my first, it won't be my last. Wonderful.
Wonderful. That's great.
Thank you. Good night, everyone.
Good night.
Thank you.
Good job, Gloria.
Thank you, Estelle.
Talk to you later.
Good night, Gloria.
Good night.
Good night, everyone.
Good night, everyone.
Hey,
Thanks,
Raquel,
everyone.
Raquel,
Yes,
Gloria,
me.
Yes.
Which
uh,
Raquel?
Oh, there's two.
Marlene, can the people who did this stay on for a minute? I really just want to chat with some of the presidents. I just want to share some information with y'all.
Sure.
Okay,
Sure.
I'm going to
And-
stop recording. There.
And Khadijah's here.